it will be my pleasure to introduce to you a dear friend. She joined us when we just started. She was a member of the NSERA for a long time as well. She does an unbelievable job trying to raise awareness on mental illnesses and disabilities on the Latino community, which is a very invisible issue. Dr. Magaña comes from the University of Illinois in Chicago. She is a professor in disability and human development at the ACCIÓN University. Her research is on the cultural context of families who care for persons with disabilities and mental illnesses, and the experiences of parents who have disabilities. She has been a leader in investigating racial and ethnic disparities among children with autism and developmental disabilities and among their family caregivers. Building on this research, Dr. Magaña has developed culturally relevant interventions to address these disparities, bringing the Promotoras de Salud, which is a community health worker model, to the disability world. She's in the process of leading a large two-size randomized trial of an intervention that seeks to empower Latino parents of children with autism spectrum disorder. She is also the director of the newly established Family Support Research and Training Center. So please help me welcome Dr. Magaña.
Okay, thank you for inviting me, Alejandra, and the organizing team. This is such a great group, you know, because you guys are in there working with and on behalf of Latino communities on many different issues, and it's so important. It's so nice to see, and you know, you're all doing community-based work, which is what I really like. So I want to talk a little bit about a particular population and how you can apply this sort of community-based work to this population. But also I'm hoping that you might be able to draw some examples that you can apply to your work in the topic areas that you're working on. And so what I want to cover today, I want to talk a little bit about what the family experience is of having a child with developmental disabilities. What are developmental disabilities? For those of you who don't know, many of you already do. And what is autism spectrum disorder? And so I'm going to talk about that, but just give you a little bit about my background. I'm originally from California. My dad is Mexican-American, third generation. My mom is Irish-American. So I have that mix, very heavy Catholicism, as you can imagine. I did my PhD work on the East Coast in the Boston area. I went to Brandeis University, and that's where I first learned about snow. And so, you know, I learned how to adapt and live in a snow environment, and then I went to Wisconsin, even more snow. But the thing about Wisconsin is that they have wider roads and they know how to plow streets, whereas in Boston, they'll plow, but the streets are so narrow because it's such an old city. The snow piles up and piles up. You know, by February, by March, oh man, they're going crazy. But at least in Wisconsin, they know how to clear it out. And then I'm in Chicago now, and so some of the research I had done, I initiated in Wisconsin, and have taken to Chicago. So I'll tell you about how that went. Just to begin, I want to give you a perspective of how parents might interact with, you know, hearing about a diagnosis of their child with a developmental disability. And so I'm going to play an episode from a radio novela that we created in Wisconsin. And when I get to the reducing disparities part, I'll tell more about how we created it. But I just want to give you a taste of the experience for families. All right, so that gives you a little taste of the experience of families who have a child that was diagnosed, in this case with cerebral palsy. You know, and I think, you know, I'm going to talk a little more about the family experience and also about the novella later, but I think that a lot of you probably either in your work or, you know, maybe you have family members. How many people have had a connection with a person with a developmental disability? Wow, so almost everyone, really. So that's really interesting. That shows you how common it is, right? And how that experience is a real challenging experience for people, but it's something that almost everybody has some connection with. So that's very interesting. So we can see how the parents were reacting. There's sort of a gender issue there in terms of that reaction, right? There was also a cliffhanger. I don't know if you noticed that. We'll talk a little bit about that later when we talk about the novella. So what does Mario do, you know, with the paper issue? I don't know. So I have seen those gender issues in terms of diagnosis, but not just with Latino families. I've seen it with white families too, where the father tends to be a little bit more in denial of the diagnosis or wants to push back on it. The mother's more interested in learning about what it's about and maybe sort of embracing some of the treatments right away, a little sooner than the father. I remember in Milwaukee we had a conference with parent groups, and there was a father panel actually, and there was a father who had a child with autism who was about 10 years old, and he was very, very emotional in his presentation. I mean, he talked about how he didn't want to believe it. He drove around, you know, the Milwaukee area for about 2 hours, you know, just to process it. And then he took his family to Mexico to, you know, to some of the cathedrals to try to see if they can pray for a cure, you know, and just really trying to process that. And the mom was like, no, we need to get on this waiting list, and we need to, you know, make sure our child is getting treatment and getting the right diagnosis. So interesting dynamics. We did a study also in Wisconsin of parents that have children with autism, Latino parents, and this mom, when we asked her how did she respond to the diagnosis, she said, it was very difficult for me and my husband. My husband denied it more than I did. I started to cry, my husband started to cry, he told me no, he wanted me to take him to another psychiatrist. He wanted another interview with him, but I said, he does have it, he does have it. It was hard, very hard. I was very disturbed by the first week. I did nothing but dream about it, bad dreams. And so, you know, you get this, you know, response, the gender dynamics as well. One of the interesting things is that there are some differences in terms of, we're doing a study right now where we're comparing these responses to white parent responses. There are some differences because one of the things that happens with particularly Latino immigrant families is they come from often a Latin American country where there's little disability awareness or knowledge, right? And there's not a lot of resources to go into disability services and treatment. So they come to the United States and then they have a child with a disability with no previous knowledge. And whereas the white parents, particularly if they're middle class, they already have some understanding, like they've heard about autism, they know something about that, and they're actually seeking a diagnosis usually. It's not a surprise, you know, it's not a surprise to them because they're actually trying to get the best doctors to get a diagnosis for their child, whereas it's really different for these parents who have fewer resources. So now I want to just talk a little bit about what are developmental disabilities, and many of you, most of you already have had contact with someone, so you know something about it, but typically it has to be diagnosed before the age of 22, and it results in substantial functional limitations in at least 3 or more areas like self-care, communication, learning, mobility, self-direction, or capacity for independent living. The most common types of developmental disabilities are intellectual disabilities, cerebral palsy, autism spectrum disorders, but there are different definitions of it. Different states have different definitions, and so some of them might include attention deficit hyperactivity disorder, vision or hearing impairments, epilepsy, and there's a long list of other disorders that could fall under developmental disability. Oftentimes people have more than one of these, right? So for example, people with autism often have other things, like they might have also an intellectual disability, a good percentage of them do, or they might have epilepsy or attention hyperactivity disorder or compulsive disorder. They might have multiple things going on. In terms of the prevalence of developmental disability, depends on how widely you define it, but CDC did a recent study where it was about 14% of children having a developmental disability. 1 in 6 children had a developmental disability between 1997 and 2008 in the data they looked at. So now I'm going to talk a little bit about autism spectrum disorders. How many people know somebody with an autism spectrum disorder? Wow, so a lot of you too. That's really impressive. And so that definition has been changing over time, and the Diagnostic Statistical Manual by the American Psychiatric Association has recently redefined it in 2013, and so right now it's defined as a group of developmental disorders that include a spectrum of symptoms, skills, and levels of disability, and they often include these characteristics: social communication, so social problems including difficulty communicating and interacting with others. That's a big part often of autism spectrum disorders. Then the other thing is repetitive behaviors, as well as limited interest in, or activities. And so that could be hand flapping or rocking or physical repetitive behaviors, or it could be repetition of language, saying the same thing over and over again, wanting to see the same part of the video over and over again, right? Or it could be the limited interest could be that they have one thing that they're really interested in, and that's all they're interested in, but they know everything about that one thing, so it's very intense. Kind of like a professor, huh?
Very academic.
Now that you think about it, right? Usually it's recognized in the first 2 years of life, and often the person's ability to function socially, particularly, is hampered, at school, work, or other life areas. So once they become, even if they don't have an intellectual disability, once they become an adult, it's really, the employment rate is super low for people with autism. So that's something that people are working on right now. So one of the things I want to say about people with developmental disabilities too is that in this, we try to highlight this in the novella, they often live in the community, right? They live with their families or independently as adults often. In the past, they were institutionalized, right? And in many countries, they are institutionalized, but we've gone through this progression where they live mostly in community and mostly with their families, even as adults. They go to school or work, get married, have other typical life experiences just like anyone else. The other thing that's important to point out is that it's no one's fault. Parents often blame themselves, or they get blamed by family members, especially moms, right? Moms always get blamed for everything. And so you didn't, discipline him right, or that's why he's like that, or something you did in your pregnancy. So mothers always get blamed, but it's no one's fault. It's important to emphasize that, and it's something that happens. It's a normal part of life. And there are services and supports that help people with developmental disabilities to live normal lives, and some people will need those services throughout their life, of course. So now I'm going to switch gears a little bit to talk about health disparities. Many people here, I'm sure, are very familiar with sort of research that's moving in this direction of looking at racial and ethnic and other kinds of health disparities in general, in terms of chronic health conditions, and there's a lot of research showing that particularly minorities have more chronic health conditions compared to whites. They have less access to services. There's a lot of research in that area, but this is taking that research. I'll be talking a little bit about that within developmental disabilities and autism. This gives us a little framework just in terms of the different phases of research. So the first thing is to detect disability, the disparities. So you're finding the vulnerable populations, measuring the disparities, and finding out where the disparities are. So that's sort of the first phase. And then you move on to the next phase, which is understanding them. So you have to get more in-depth. This is where qualitative research really comes in handy, to really understand why are these disparities existing, and identifying the different determinants of those disparities. And they could be at the individual level, the provider level, the clinical encounter, or even the broader healthcare system, or even societal level, right? Then the next phase is reducing disparities, and so that's where you get into developing interventions. And a lot of you guys are doing work to reduce disparities, because you're working with vulnerable populations, and you're trying to tailor different activities and programs to help people with their health in many ways. So that's where the reducing comes in. So I'll talk a little bit about research that I've been involved in these different categories. And I want to start with detecting disparities. So that phase of the research, and talk about children, adults, and mothers who have children with disabilities. So first I want to talk a little bit about autism in terms of the prevalence of autism, because there's definitely disparities as far as diagnosis of autism between Latino children and white children. So I want to talk a little bit about that. So one of the things you see here is that, so now you can hear me better because I'm closer to the mic, huh? Now you can see that, and we've known that there's an increase in prevalence over time. So you can see that here, you know, how it goes up over time, you know, between 2000 and 2014, you know, big increase. The CDC has been involved in surveillance studies. You know, every few years they do surveillance studies to update the data. And, you know, why there's an increase in autism over time is a whole other different presentation that somebody else would have to do. But we know a lot of it does have to do with the expanding definition of autism too, and recognition, a lot of resources and services going into that field. But, you know, so what they do is they take 8-year-olds at a point in time, and they look at all 8-year-olds that were born in a particular state. So they identify several states that they work with, the CDC does, and they take 8-year-olds to look at their medical and school records to see if there's evidence of autism, and that's how they determine these prevalence rates. So when you think about it, that's not really prevalence, right? What it means is they've identified the rates of people who got a diagnosis or who got, you know, information in their medical records. It doesn't mean, like, you know, when you think of prevalence, there's no blood test for autism. Like, you can't, you know, determine biologically at this point who has autism. So it's all based on observation and a really thorough diagnostic process, and it requires a lot of training to do the diagnosis. And so you can imagine anything that's that complicated requires money and resources to get to that. And so you can imagine that people who have higher resources, more resources, are going to be able to access the diagnosis more. And that's basically what happens, and we'll talk about that a little bit. So another population that's growing a lot is our Latino children in the United States, and many of you work with Latino children, right? Mm-hmm. And so you can see that between 2000 and 2014, there's been a 62% increase in Latino children, and these are numbers in the millions, so you know, 12.83 million Latino children in the United States as of 2014. And then if you project in the future to 2021, you can see that it will be at least a 24% increase. So here you have an increase in autism diagnosis, you have an increase in Latino children. So you can imagine that if you put those two together, there's also going to be an increase in Latino children diagnosed with autism. So if we look at the CDC data, you can see that the rate of diagnosis is lower than the previous chart I showed you of diagnosis of the general population. So by 2010, it's about 1%, 2012, 1%. If you remember, for the general population, it was 1.5%. So there's a disparity right there in terms of who gets a diagnosis. It's not, you know, disparity in the prevalence of autism, but it's a disparity in who has access to diagnostic resources. You see the same pattern in this data with low-income folks. So higher income families have higher rates of autism diagnosis among their children. So similar pattern where it really takes a lot of complexity to get to a diagnosis. But you do see an increase if you look at between 2002 and 2010, there's more than a 50% increase in the diagnosis of autism among Latino children specifically. So it is the fastest growing autism population that's being diagnosed. And I just wanted to show this data because what CDC does is they look at these states and they collect data in these states, and it's so variable in terms of the rates of diagnosis in each state, but you can see the general pattern is that if you look at the whites and the Latinos, big differences there. But I highlighted the Midwest states that are in here, Missouri and Wisconsin, and interestingly, Missouri is not doing such a bad job diagnosing Latino children with autism.
Well, we have.
So I don't know what you're doing in Missouri, but it's very similar, right? But Wisconsin, maybe not so much. You know, they have very low, and part of the problem with Wisconsin data is that they weren't able to access school data. The Department of Education didn't allow them to, so I think their data is limited there. But that's interesting about Missouri. So I want to talk about a study that I did in Wisconsin when I was there, looking at disparities in specialty services and for children with autism. And by specialty services, I mean typical services that children with developmental disabilities and autism should get, so beyond regular health care, but you know, maybe like therapies and things like that. One of the things we looked at, you know, because there are these disparities in diagnosis, so we wanted to find out if there are differences in the age that the parents first noticed something about their child, and then the age they told the doctor, and then the age of actual diagnosis. And what you see here is that they were similar in when they first noticed something. And they were also similar in the age that they told the doctor. There were no significant differences between the groups here, which is an important point, because a lot of times I hear people say, yeah, but it's because Latinos, they're in denial, they don't want to, you know, they don't want to talk to their healthcare professional about it. Well, this shows the opposite of that. So they do. They are concerned. They are noticing these differences, and they are bringing it to their doctor. But when you get to the age of diagnosis, that is a significant difference. It's a year difference, you know, where the white children were being diagnosed at 3, Latino children at 4. 1 year in a child's life is a lot. And you know, a lot of the research is showing that the earlier you get intense intervention, the better for these children. So they're losing a year of that. And this is Wisconsin. I mean, Wisconsin is actually doing a better job than many states in terms of the age of diagnosis. In Illinois, where I'm at, they don't even have data on this, but the data that we can find is showing that the average age is around 6. That's terrible. I mean, for all children, not just Latino children. So difference, I don't know what it is in Missouri, but it really varies by state and how well they do with their service system. Then the other thing we wanted to know along those lines is how did the doctor respond when they first went? Because maybe that's how come there's a disparity, right? Maybe the doctor is you know, discriminating against one group or the other. So we asked them questions like whether they referred to a specialist, conducted evaluations, or if they said things like the child will grow out of it, it's normal behavior, let's wait and see. And the surprising thing here is that the majority of pediatricians in Wisconsin did not have a proactive response. The majority of them said, you know, only 35% of them, you know, had a proactive response. So they would say the child will grow out of it, let's wait and see, and so on. And that was not significantly different between Latino and white children. In fact, the white parents reported that more, that the doctor was more likely to have a, well, yeah, so they're more likely to have a proactive response, but it wasn't significant. So that doesn't explain then why there's a later diagnosis, but you know what, the way, we didn't have the data to really pinpoint this, but I'm thinking that it has to do with the fact that the white families have more access to resources, the internet, and you know, professionals, and they're more trained in terms of how to advocate for themselves in the medical system, so they're more able to look for second opinions and not just go by what the doctor said, right? Whereas the Latino parents might be more willing to listen to the doctor. He's a professional, you need to respect his opinion, and they don't have the resources to pursue other avenues anyway. And we did ask the families, where did they learn about autism once they got a diagnosis? And so this data kind of reinforces that theory, because the white families, which is the lighter blue color, had much more access to the internet in terms of learning about autism, other parents, books and magazines, and friends. So they had significantly more resources to learn about autism than the Latino children. And so that could be contributing to that. So then we looked at differences in key services for autism, and so all of you are probably familiar with the Birth to 3 programs, which are mandated across, you know, across the country. So all these children should get birth to 3. But what we see here is that about close to 80% of the white children got it, and only about 50-some% of the Latino children got it. They should have all gotten it, but if they're not getting diagnosed till 4, they missed it. Then there's the early childhood program, which is also mandated for school districts to provide. And so that's children between 3 and kindergarten, and then there's special education with the IEP process, right? And we're seeing that even out a little bit more, at least in Wisconsin, where there were no differences between the two groups in the early childhood and in the receiving an IEP, which is good. We didn't look at the quality of those things, but at least they're equal. The thing that was a big difference and something we were really working on in Wisconsin, they have this great program, and not all states have this, for providing evidence-based treatment for children with autism using the Medicaid program, and they have a Medicaid waiver. And the Medicaid waiver allows children who are eligible to get intensive autism therapy, like 20 hours a week, which is what the evidence shows is effective. And so what we see here is huge differences between white and Latino children, which is kind of interesting because all the Latino children were pretty much American citizens and on Medicaid. So they're already eligible, right? The white parents were more middle class and upper middle class, and yet they access the service more than the Latino children. And part of it, in different states, sometimes they will increase the income level for Medicaid for children with disabilities, which is a good thing. But you know, it allowed these middle class families to be more aggressive about accessing the service, whereas the Latino children were not. We're not getting it. And you know, when we talk to parents, a lot of it is there's so many barriers just to get to that. I mean, first you have to get the diagnosis, then you have to find a provider. All the providers speak English. You have to find a provider, and then you get on a waiting list. I mean, there's all these iterations to get this service. So there are many barriers that Latino families faced in that. So I'm going to move on to looking at national data. So we did some investigation looking at national data because those were more convenient samples, you know, in terms of the data in Wisconsin. So we were looking at representative data on healthcare access, utilization, and quality of care. So just seeing a doctor and getting health care for children. And so the data we used was from the National Survey of Children with Special Health Care Needs, and we selected the children that had developmental disabilities and autism specifically from that sample, so that was about 5,658. And if you look at some of the demographic differences between the groups, you can see that the white children, which is the light blue, had more diagnosed with autism than the Latino or Black children. And then you can see that the Latino and Black children were more likely to have incomes that were lower than 200% of the poverty level. So a lot of income discrepancies, even in a representative sample. So in terms of our findings, you know, we looked at healthcare access, which typically is measured by insurance and some other things like that. And this, you guys, this is probably not new to you because in every area that you're working with children and families, Latinos are less insured, right? And so you see that pattern here, where Latino children are 3.44 times more likely to be uninsured than the white children. They're also more likely to say that their needs were not met by insurance. And then these are some of the utilization variables. So difficulty using services. Latino parents reported the children had more difficulty. They also were less likely to have 11 more doctor visits in a year. So they had lower utilization. And then quality was something that we looked at in a few ways, but these are some of the quality variables. There's some others like not being able to, not understanding my family, my culture, some other things like that. So this is at the provider level, like how the parent perceives the pediatrician responding to their family. And first of all, Latino children were more likely to say they didn't have a personal doctor. So they might go to a health clinic where you get rotated to doctors and things. They also reported that doctors didn't spend enough time with them, they felt, African American children as well. And they are also more likely to say that the provider didn't listen to them. And the other factors that we measured were also significant that way. Now we wanted to see if this data, if these findings would change over time, because there's been a lot of policy statements saying we have to reduce disparities, you know, the American Academy of Pediatrics and Healthy people, 20, whatever, 20, you know, they're all saying, they're all saying reduce disparities, right? But so we want to see, does that have any impact? And so we looked at this data in 2010, so because the people collecting this data do it every 4 years. And we wanted to see if there was any change in the level of disparities, and we found, sadly, no changes in disparities. So those disparities persist at this point in time. Maybe we need more teeth to those policy statements, right? Some penalties, some you know, incentives, things like that. So maybe we need to get to that level. So then, just I'm going to move on to adults real briefly. We're looking at another national survey, National Health Interview Survey, and looking at health outcomes for adults with developmental disabilities and racial and ethnic differences. So you can see that the column, the light blue column is African American adults, and this is Latino, and this is, is that right?
No,
Yeah.
no, light blue is light.
Right, like the dark blue is Latino and the green is white. So you can see that both Black and Latino adults are reporting that they are in fairer poor health compared to whites. And then mental health, same pattern. They have poorer mental health than whites. And then they also have higher rates of obesity and higher rates of diabetes, particularly the Latinos in the diabetes category, interestingly enough. So those are similar patterns to what you see in the general population, right? Where you have these kind of disparities between racial and ethnic groups on these very same outcomes. But one of the things we want to know is, are they exacerbated among people with intellectual disabilities and developmental disabilities? And in this analysis, what we did is we compared within each group. So this is within Latino. So what we see is that the light blue are Latinos with intellectual and developmental disabilities. The dark blue are Latinos in the general population that don't have disabilities, and huge differences in all of these outcomes between Latinos who have disabilities and who don't. So you can see that that's really exacerbated for developmental disabilities in that area. And it's really a neglected population in terms of health. People aren't really thinking about health, and particularly within families, because a lot of these Latino and African American families are living at home as adults. And it's the whole family that really needs health intervention and care. Then we looked at mothers, because what's going on with the moms who all their life have been taking care of children with developmental disabilities. And in this, we also used the National Health Interview Survey, and we looked at mothers that were 40 and over, because we wanted to see sort of what the impact, as they, you know, they've been doing this all their life, so over time, we know what was their impact. And so you can see this is Latina mothers with a child with developmental disabilities compared to those without. And so significantly more depressive symptoms for these moms. The other thing is we were surprised to find also chronic health conditions. So they actually had more heart problems and more arthritis. They also were more reported that they were less likely to have seen a doctor in the past year, the moms that have a kid with a disability. So you can imagine they're just not taking time for themselves, right? They're taking time for their child. So those are the sad news. You know, I mean, it's kind of depressing when you think about all of this all at once, right? But I want to move to a little bit of understanding, and then a little bit about what can we do about it, you know, so we can get into more productive discussions about that. So in terms of understanding, there's a lot more research that needs to be done in this, and like I mentioned, I think we need a lot of qualitative work to do this, but one of my colleagues, Katie Zuckerman, did a qualitative study with Latino parents around autism and developed a conceptual framework from that. So it's a good way to think about it. These are the themes that emerged from her study. So you have these sort of themes, community knowledge and perceptions of autism, parent-family factors, healthcare system factors, and then those lead to the consequences and disparities. And so community knowledge, and you know, like I mentioned, there's a lack of information about disabilities and autism in the Latino community. And so, and that can lead to increased stigma around these disabilities. There are also cultural factors that we mentioned. And then parent-family factors can include, obviously, limited English proficiency. Many of you are working in many different programs where that's an issue. Lack of awareness of services, so knowledge and awareness of what services their child should be getting, and poverty, high rates of poverty in immigrant populations. And then healthcare system barriers, providers dismiss concerns. We talked a little bit about the provider level. They could also discriminate. That's another issue. They might discriminate against different racial and ethnic groups as well. So those issues, they lead to confusion about autism, denial, erosion of trust in the medical system, which then leads to either disparities in diagnosis or receipt of important services or health care. So that gives us a little bit of a model for thinking about the why issue. But now I'm going to move to what I would call fun part, which is addressing disparities and the needs of the community. And I like to show this graphic because I always get asked, well, why do you work with Latino families? Like, aren't these issues important for all families of people with disabilities? And I say, of course they are. But if you think about it from this perspective, so you have equality versus equity, right? So equality means everybody gets the same resource. So you can see in the graphic on the left, we assume these are children, they're trying to reach some fruit. They all get the same resources, the taller child gets to reach it, but the other kids don't, right? So if you give more resources to the children that need it, they're going to have equal outcome of being able to reach the fruit. So I think that's a good way to think about why do we need to tailor programs for vulnerable populations, and particularly Latino populations. You could all use that argument, right? And so one of the projects we did was this novella project, which you got to hear the first episode. This was a really fun project. I mean, it was really done by all volunteers and with Family Support 360, which was an organization in Wisconsin at the time with the Wiseman Center. It took about 2 years to develop this novella with the 13, they're 5-minute episodes, and it got played in the radio station there in Madison, Wisconsin. The way this started out was interesting. It was Spanish-speaking parents who themselves were talking about how marginalized they felt in their own Latino community because the other parents and children didn't understand their child with disabilities, and they felt uncomfortable going to events in the Latino community because they would get teased, or people would be blaming, they're bad parents, or all kinds of stuff going on. So they really wanted some kind of an awareness program for the general Latino population to understand disabilities. And so we had a team that got together to address that. This is Diego Campoverde, who was an engineer at the radio station. He helped us quite a bit, so I'll talk a little more about how the radio station played a role. So we had all these organizations that collaborated, and some were in a planning committee, some were in a writing committee. We had this group of Latino students at UW-Madison that, from the Latino Student Psychological Association, that met every week to write these scripts. So they got the ideas from the disability planning committee. They came up with the topics, and then the students actually went to the support groups of the families to hear their experiences, and then started to write these scripts. And then we even we had a little bit of money, so we were able to hire a professional writer who had a child with a disability, actually, and she kind of cleaned it up and made it more entertaining, sort of put the cliffhangers in there and a little bit of humor and things like that. So we had the professionalized a little bit, and then the radio station, we had some money to pay them to help us engineer the whole thing, or produce the whole thing. So Diego, who I mentioned before, he played a big role. So he did, we would go to the radio station, and we had all volunteers as actors. We didn't have professional actors, so they were some of the students, some of the parents, and some of the radio personalities also contributed. And so Diego would be the director, and you'd go into a recording room, and he would record you acting out the script, and he'd say cut, and you'd have to do it over again. But he was really good. And then he did all the editing, put all the did all the final editing and put those sounds in. You heard the sounds like the car and the, different sounds in the hospital room and things like that. He put all those sounds in to make it sound real. So this was part of our team. But that was a really, really fun project, and something you could do with any topic area, any area that you're interested in. In fact, we got the idea because there was a group that did this with postpartum depression for women. They did this in Madison, and we said, well, maybe we could do that for disabilities. So this, could be used across different areas that you guys are working in. This is a project that we did a randomized trial for. It's called Cuidar mí misma, puedo cuidar mejor a mi familia, and which is taking care of myself. I can take better care of my family. It's a really long name, but we really had to use that long name because a lot of the Latino parents, mothers, feel guilty if you just say, taking care of myself. That's just too, selfish to them, to many of them. And so they really had to get through being able to understand that they had to take care of themselves in order to take care of their family, and that was important to do. So we developed this intervention. Okay. In this intervention, we use Promotora de Salud model. How many people have used or worked with promotoras or community health workers? So really good way to work in the Latino community, right? So in this case, promotoras are typically lay people from the community who are, they know the language, they know the community, they're respected. But we added that we wanted them to also be a parent of a child with a developmental disability. So that was a criteria. And so they did home visits with this project. I don't have a lot of time, so I'm just gonna show you that with our randomized trial where we had the treatment, which is T, and the control group, we did find confidence in being able to use the health strategies we were teaching, so they had increase in that. And then all the behaviors, we saw the same pattern. But I'm going to skip this because I do want to get to the next project, which is PADRES and ACCIÓN. Because this is a really exciting project where we're building on this Promotora model. We're working with parents of children with autism. And the way this developed is that we had a community organization in Milwaukee. We started a pilot there that basically, there was a parent who was working in that organization of a child with autism. She was from Costa Rica. She worked with a lot of Latinos in Milwaukee. And she said, I like that Promotora project you're doing, but I think we should do this for autism. So it was really her idea, and we started to look for funding, and were able to develop this model where we were teaching basically, we used these concepts to sort of make sure it was culturally relevant, but we were teaching what is autism in more detail, what is evidence-based services, that you should be getting for your children, how do you get them, how do you advocate for them, and then what are strategies you can use at home that are evidence-based, and the promotoras, these are the Chicago ones that are still working with us. We started in Chicago about 3 years ago. They're still working with us. And they really grasp this content. I mean, it's complicated material, but they have no problem grasping it because they live it. They understand it better than I would. And we're doing it in California too, so we have a 2-site project right now. So we're in California, we're in the middle of that. We have intensive training we do, and I'm happy to talk to anybody about this project later, because if you're interested in learning more about it, I'm happy to share information. And so I'm not going to go through a lot, but our preliminary findings show that there are good outcomes for this project so far, even in increasing the number of services. And I do want to get to this last point, which is that we're doing it in Colombia right now. So yeah, we went to Colombia in January. I always try to go to more places in January, so yeah, and so we did the training. They have promotoras. They're actually in the middle of doing this project. We had to make some adaptations, of course. There's some language differences in terms of, we were using more of a Mexican-based language, and so there's some wording differences between Colombians and Mexicans, right? And then also the service system is totally, they have no services, so we had to adjust that to it, but they're in the middle of it. So I have a colleague right now who's on her way to Colombia to do the evaluation part of it. So that's really exciting, and I have other colleagues in other Latin American countries that are interested in this, so we're hoping that this would be a good model to use in Latin America as well. And so just lastly, because I need to end, just some takeaway points, at least in relationship to the interventions, is that it's so important to listen to the needs of families, to include them in developing interventions, and to work collaboratively with community-based organizations. And what I learned too is that it's really important when you're writing your grants, that you include funding for your organization. You know, that's going to enable them to work with you. It's also important to empower the populations you're serving. The other thing is, I think it's important to know that you can employ rigorous research methods in community-based and empowerment approaches. You know, I hear people who do CBPR and they say, oh, you can't do randomized trials with CBPR. Yes, you can. You can use rigorous methods. So I think that's an important takeaway. And then the other thing is there's always so much to be done, right? You guys are out there thinking of the next thing that you have to do. But thank you very much for allowing me to come and share this with you. I'm happy to share on an individual basis any